you lift up the epiglottis very clearly, and now you have enough time. You keep your armamentarium very simple to understand, then don't go for too much of long list of your instruments, and also there is no need to go for very high end and too much of instrument. You buy what you need. So important point here is the intubation is, we have seen here like same thing. Intubation is just the process. What count is what you do after that. It's planning like your debulking, your cryo, your APC, cautery, snare, all these things, putting a stent, dilatation and all. So important point here, we have discussed this tool. Later on, then your training, technique and troubleshoots are very, very important. And also you sync with your anesthetist, because that way you are sharing your airway. And very important about, because same airway you are sharing, he is also have to ventilate and oxygenate the patient. And ventilation is in question when the patient is doing jet ventilation. The more important is oxygenation. When the patient is in jet ventilation, the timing is over, because you cannot keep the jet ventilating patient for longer time. And the teamwork, of course, because your technicians, they are very important. You train them well, you discuss your cases well, and they should also be familiar with your instrument, how you need to do, what you require. Because when you are doing the procedure, that time you are only focused with your airways, and then you need other instruments. So he should also know familiar about the procedure and well versed in that part. Good thing about the rigid bronchoscope, the damage potential is low, because they are the like metallic tube. It is not that as much as your with the flexible scope, but with the telescope, sometimes when your patient's neck mobility is not there, you are turning too much of all the flexing it, then sometimes your telescope can also damage. So that's because you need to keep it in the midline. That's why your holding of the rigid bronchoscope position is very important while you're going inside. Your telescope should not bend. Endoscopy suites are more economical, because every time then our OT people or anesthesiologists, sir, we are more comfortable in OT. Why don't you do the procedure in OT? We know about that. It costs significantly. So then make your endoscopy suite in the way that we will do all procedure. You get your anesthesia machine, because rest of the our all instruments and our procedures are there. So we are more familiar with the our endoscopy unit and safe to reuse. Thank you very much.